We'll get started. Good morning, everybody. Welcome to Insight class at First Presbyterian. We have these Insight classes is where First Presbyterian's identity, faith, and values meet today's world. And we are currently in a series of moral and ethical choices being made at work, and have asked people from different professions to talk with us about the moral and ethical choices that they have in their profession and what they see at work. We are recording these meetings, and in fact, most of the participants watch them after the fact on YouTube. So if you want to look at some of the other Insight classes, you can go and check out the webpage, the First Presbyterian webpage, and there's a link to our previous Insight classes. We're very honored this morning to have Dr. Ghosh come talk with us today. He is an oncologist and practices in the Ghosh Center for Oncology and Hematology. He's spoken with us in years past, and it's been very successful. So we're very happy that he is back here with us today. With no further ado, Dr. Ghosh, I turn it over to you.
Thank you, Matt, for a very kind introduction. And thank you all coming this morning. And I hope it will be a good interactive discussion, because the topics, moral and ethics, is not an easy topics to address. The way I look at it, moral is a set of values that we decide is the right things to do. And the definition of ethics, I was looking at the dictionary, is hard to pin down, because it's a series of values that is put together in ethics. Ethics comes from the word ethos, that came from the Greek word. And the Western civilizations, the Greek really came with the democracy and all the values and ethics. So a lot to learn from their history. Now, the way I look at it, purposefully, I did not make any slides. I thought that I will share with you what I have learned being in different parts of the world. The moral and ethics, I will say I have my personal moral and ethics. We all have. The family moral and ethics, the moral ethics of the community, the moral and ethics of the county, state, country, and the world are different. And I can give example of those. But all those moral and ethics are tied together with the spirituality or religious faith, which is we are all created by God, and we should love each other, respect each other, and we should learn how to live together in this world. So what is right things for me morally may not be right things for somebody else. But we need to understand why that is not right for that person, rather than kind of deciding my values and ethics is the way to go. And if you do not agree with my values and ethics, you are my enemy. And I don't think that solves the problem. I'm giving an example. Many years back in India, there was tremendous mortality during the childbirth. And that was true in United States too. But in India, after the mother died, the babies survived from the milk of the cows. So during those times, they decided that cow is like a mother, because without cow's milk, they would not have survived. So the moral part of that part of India, they worship cow. And that's not true in Western world because at the end we have to eat. Food sustains the life, and life many ways equates to God. So you can see that how the moral of two parts of the world are different. And I don't think one is better than other. In different situations, they came up with different moral and ethics. So in healthcare, I want to make sure that I don't say anything that becomes too much controversial, because I think moral and ethics could be controversial issues in healthcare, particularly. Uh, what I think moral and ethics in my practice, in my center, may not be a moral and ethics for a lot of other people. I think that we need to follow the laws. For example, we have a law that passed twice. It's called Patients' Bill of Rights. What that means is that it is the patient, it's their life. They need to be part of the decision-making process. That's the law. So my moral and ethics is that I'm going to follow that principle. And I do. I explain to the patients the risk and benefit, including the financial cost, because I think that's the morally right things to do and that's the ethical things to do. I know it's not being done for varieties of reasons. Should I criticize them that they are immoral? No. So different people sees the moral and ethics different ways. Many members of your church has helped in founding the APG Foundation. And we identified the problem, and the problem was, it's almost 14 years back, that I was writing a prescription and then I will see them in follow-up in a week, and then I realized that they did not buy the medicine. And those are not immigrants, those are bi-generational Pseudorhaphidians or Iowans. So we all came together, and most of the active member of the board even now is members of your church. So we felt that we need to do something. We felt that it is not a moral thing not to extend our hand to those people who are suffering. That led to this creation of foundation, and it's still running for 14 years. And this foundation has given close to $600,000 to those people who lives in our community. Did every other doctors or members of the church did same thing? If they have not done it, are they immoral? I don't think so. So how we felt that it is our ethical duty to extend our hand to those people who are created by God and needs help. I can keep talking, but if it is okay, I would like to hear from all of you. And I think the interactive discussion may be more productive than me telling one-sided stories. Would you like to participate, or I just keep going?
I am very interested in what you have to say. I would say that I'd be happy for you to keep going, but since you're asking for a question, I will ask one,
Sure.
which is, there's, especially in the field of medicine, there's there's just unlimited, at least from the standpoint of one person, there's unlimited challenges. There's many people that are sick or facing medical challenges. Uh, is it difficult as a doctor to sort of draw that line, not to, you're only one person. I'm sorry, I'm not articulating a question very well, but it seems like that would be a huge challenge, because you might think morally or ethically that you'd like to help somebody, but with so many people that you could potentially help, how do you make those kinds of choices?
The issue, that's why I did not get to that discussion, but you brought it up. The issue is very complex and complicated. The way I look at it is me. So me, I mean, I'm not saying everybody should do that. I see that I am mind and body. That's me. I do everything to be successful in that project. And that project is defined by my moral and ethics. And if that project becomes successful, that's God's grace. And if it does not, I have given my best. That's the way I have lived my life, because everything I do is to feed my inner soul. Because I am a mind and a body. It's a structure that God has given, and inside there is a soul. I need to feed that. So I'm not controlled and governed by outside activities. Does outside activities affect me? It does. And it is getting worse and worse in the healthcare than before. Matt, what you said is one part. I will tell you that how many times what I have seen, we are not very candid to the patients. We push the test and the treatment that is either useless or minimally benefited, it provides minimal benefit at the cost of the enormous expense. For example, in the cancer care in the United States, 1 out of 4 or 5, their financial life is destroyed from the treatment. And we are not candid and upfront explaining the risk and benefit, including financial risk and benefit. So many times we lure the patient. You need to understand the word cancer is a scary word. People are scared. They will do anything, everything they could do to survive. So that issue is very complex and complicated. And I'm glad that I don't have to work for a long time, because I think it is becoming harder and harder to stay focused on the patient side. Well, that's the oath that I have taken, and I do. I do my best, but it's getting harder. I will tell you, we're talking about moral and ethics, but I'm going to change the laws. Medicare CMS has courses that we are supposed to take to make sure that our action does not fall to the categories of fraud and abuse. So every year I make sure all of my staff takes, including me. And every year after that, the staff comes, Dr. Ghosh, this patient's coming from that place. What is this? Should we report or not? Because as per the law, that's a outright abuse of the healthcare dollar. And the answer is, it's tough, because the way United States runs, I'm sorry, if you report to those folks, they have the power, they have the money, they will crush you. So at the end, again, the moral and ethics comes to me, which is how I'm going to use my time effectively. If I do that, then I will be dragged to barrage of deposition, lawsuits, and other, and ultimately I will have less time to take care of my patients. So many times we shrug the shoulder, but we see that absolutely frequently. Matt, does that, you ask a complicated questions. I don't know how much I answered.
I think my question was overcomplicated and your answer was very clear and to the point. So thank you.
No, at the end of the day, I think that, we need to decide what is the purpose of this life. And then we need to define what is the right behavior or rules that we need to follow. I mean, I I don't want to be political, but do you know the food stamp, how in United States, who started and how it got started?
It was Lyndon Johnson, I believe.
Huh?
I
Fred?
believe it was Lyndon Johnson.
Yes. So I think it was Fred. You were right. It was actually it was President Kennedy when
Okay.
he was campaigning in West Virginia, and he was shocked to see the the starvation. And at that time, the farmers were also struggling. So the intent was to win-win, help the farmers and have the food stamp. Food stamp. That's why the food stamp is under Farm Bill. And you will see the battle between the two political party. One wants. But anyway, so that was the moral things that Kennedy felt, and it did not go far. Actually, it was Kennedy, President Kennedy, who really took this and increased the food stamp by fivefold. Why that happened? Why that happened? Because throughout the world at that time was seeing the documentary that how many people in United States was starving to death. So people thought that in a rich country, that should not happen. Your church feels the same way. That's why over years you feed the people. You don't ask whether they're lazy, bum, or whatever. You feel that you need to do your part to help the people. So that's the story of the food stamp. So even now, I know a lot of people even in Iowa has hard time putting food on the table. See, now I'm extending from my personal moral and ethics to community like your church, beyond that, taking to the country level. But
We still
countries
love you.
react in different ways. So this moral and ethics just varies from individual person to family to community to church to the state to the country to the world. So Fred, did I answer your questions?
Yes, thank you.
So I will tell you that in the healthcare, so I'm going to change the country level moral and ethics. Do you think that we should have universal healthcare as Bernie Sanders and Warren proposed? Is it universal healthcare should be a universal right? Is it a moral and ethical things to do?
I think it is.
Okay. So who is going to pay for it, Fred?
Well, I know it's going to be expensive. I'm not sure who.
No, we need to know. I mean, say this, if I think that I want to feed 100 people because that is my moral obligation, I need to know how I'm going to pay for it. Does it make sense?
Right.
Okay. So let me extend that discussion, this moral and ethics. If it is a federal government, 70% of the tax in federal government comes from the people like us.
Right.
Income tax, whatever, not the corporations. Corporation and other is 30%. So if we are going to make health insurance for all, the expense will go up. Morally, ethically, that is right. Are you willing to pay more tax? Fred, are you willing to pay
I
more?
would be willing to pay more tax.
Good. So then your thought process is correct that I want this to happen, but I'm willing to contribute my part.
Correct.
Now, why you want universal healthcare? Because the most European country and Canada has universal healthcare? Is that a reason?
Well, I think just to make it available to people needing physicians that can't afford it.
Okay. Okay. So what kind of care you are talking about? Being oncologist, I can tell you that we are coming up with a new drug every day, and it prolongs the life by a few months, and it's $100,000 to $200,000 per year.
Wow.
So I was talking to a group of nurses who are graduating from their class, and one of the member of the audience said that Europe does it, Canada does it. You probably know they also ration the care. What I have seen here in United States, we want everything.
Yeah.
We want everything. I asked that student who is going to be a nurse, I said, let's assume that you get a call from the emergency room that your 93-year-old grandmother who has dementia, don't know anyone, was in the nursing home, and now they transfer to the emergency room and the doctor is saying she's sick. We need to decide to intubate or not. What would you do? She
It's a
said,
difficult question.
huh?
It's a difficult question because the probability of her living longer uh, is slim and none. And whether you want to put the resources into prolonging her life, which might last uh, another couple of months, uh, is that worth the expenditure?
See, again, it's a moral and ethics question. See,
Right.
you are questioning yourself, but this girl said, no, I cannot let my grandmother die. So she is willing to intubate, knowing that she still may die, or if she comes out of it, will have dementia, no quality of life.
Right.
Somebody is going to pay for it. Is that right? So who is going to pay for it? So I think in European country, see this, Europe is, each country is a homogeneous country. So they have a same level of thought process, more or less, than what we have here. We have a diverse group of people, diverse way of looking at the life. And I think, to me, in my value system, I think everybody is going to die. That's the way God created. Human body is not going to last forever. We need to
Right.
live life. Dementia in a nursing home, not recognizing any family member is not a life. So to me, in my value system, no, I'll not do that. But who am I to impose my thought and value system to this young girl? So she will intubate, and she, an ICU admission is nowadays at $30,000-$40,000. See how complex this issue of universal healthcare comes.
Wow.
In one set, yes, everybody should have access to the doctor. Yes. Should we do as UK does? UK has two kind of healthcare system. One is a national, where they do most of the thing that is value oriented. That means, they provide the free vaccination, routine checkup, care of diabetes, and on and on. Best care of cancer. They don't approve drugs in a second, which prolongs the life by a few weeks at the cost of $100,000. They just don't. So they agreed that we can do what we could do, but we are not going to do things which is more expensive, and it is going to come out of everyone's pocket. The tax is everybody's money, is that right? So the value system there is different than here.
I don't think you can, I don't think it's fair to compare the United States to Europe, our homogeneous population, sorry, our heterogeneous population versus European countries, relatively homogeneous populations. But I think you can compare us to Canada and Australia, which both have large immigrant populations, a number of first and second generation citizens. And both Canada and Australia opted for forms of universal health care. They're slightly different, but both of them provide the bare minimum to keep people alive, to treat basic illnesses at relatively low cost to the patient. And to me, that's the comparison we should be making. And to me, at one point, there were only, I don't know if this is still true, but at one point, there were only two nations in the entire world that didn't have universal health care: the United States and Zimbabwe. Zimbabwe under Robert Mugabe. I'm not sure that's a comparison we want to make. I don't think we want to be in the same boat as Zimbabwe. So to me, it just makes sense. Partly, it makes economic sense. The longer you keep people alive, the more taxes they pay.
Absolutely.
So let's keep them alive so they can pay in.
Yeah. The Canada and UK is not, I have traveled to UK and Canada. I spent a lot of time with the people and the doctors to get a first-hand experience. But, Canada and UK has a lot of similarities. In Canadian system, also there is a restriction of the care. And you have heard, in the United States, we frequently quote Canada, and you have heard that political leaders said that Canada, you have to wait. If you want to have a bypass tomorrow, it's not going to happen there. You have to wait for 3 months. If you need a hip, so they also restrict the care. So fundamental question is, yes, universal healthcare is good, but are we going to have some restriction of the care because we cannot pay for everything? That's the question. Are you going to buy with Canadian system that for your hip, you have to wait for 6 months? They have a scientific reason why you have to wait for 6 months. It just did not came from, I don't want to pay for it. So what I have seen in United States, in my practice, many times with back and forth discussion, many times patient understand that this may be the time to quit. So in United States, it's a fee for service. More I do, more I get paid. More I order the test, more I get paid. So there are two different healthcare systems. In Canada, if you're in the government system, you are salaried. Whether you run the test or not, your income does not go up. So is any universal healthcare system. But here, I see that in my cancer care, people get the test for nothing. I'm talking about $300 CT scan and other for nothing. Why that happens? Either it's an ignorance that is not going to help the patients, or incentive, financial incentive. So this is a very complex discussions. The answer is not easy unless we are willing to change the process of the healthcare here. See how the moral and ethics, Tom, you are talking about moral things, why we cannot do what Canada does. Absolutely right questions. But how you get there? I mean, if
I don't deny that the cost is an issue, but like Fred, I think the cost of doing nothing is more than the cost of treating people. The moral cost of doing nothing. Certainly the financial cost of doing nothing, well, it's really cheap. We do nothing, we don't pay anything, that's great. But letting people suffer because we don't want to do something doesn't make sense. Now, at some point, as you've already alluded to, quality of life becomes an issue. Is it worth paying $100,000 for somebody to live an extra 2 months when that same $100,000 might be able to cure 100 other people? No, that doesn't make any sense at all. So especially if the quality of life is near zero. Good morning, Cynthia.
I've also been listening in. One other thing to consider is the fact that if we don't care for people early on, they'll show up in the ER and have much more advanced cases of whatever could have been treated at an earlier time. So,
No, you are right. All of you are very caring group of people and making things which make sense. Absolutely, that makes sense. But say there is other group here in this town. I have friends who have a different views, and they have an exactly opposite view than what you are saying. So the whole issue is the moral and ethics. To us, I mean, I agree with you. I mean, we are one of the country, probably only one country where childhood vaccination is not a national right. We do it in a county basis. Lynn County does, other county does. Can you imagine an advanced country, we don't provide childhood vaccination that has much better outcome? We don't provide that. And the vaccines are expensive. So where do you start? I mean, if you look at the maternal mortality, and I'm talking data, I'm not talking about cable news stories. If you look at the data, the maternal mortality in the United States is very high. And then if you look at why it is high, because unfortunately, those are socio-economically disadvantaged group, and many of them have Medicaid, and the way we treat the people who have Medicaid, in my book, is immoral. Because they are part of the society, they contribute to their own way, and as a society, we decided to help them, so they should not be treated differently. Studies after studies have shown that the healthcare system treats those people differently. So that's immoral. So why in United States we'll have no childhood vaccination as a national program? Why the maternal mortality, which could be reduced? California did a study and they honed down to see if we do more prenatal visit and other, can we decrease the mortality? And in a small project, they did. So the nutrition, most of the healthcare problem that we have, 60% of our healthcare problem is due to bad nutrition. If you look at the childhood obesity, it's nothing but bad food, processed food. We are feeding those kids bad food. They're getting addicted. We are subsidizing for a lot of other things. Why not we subsidize to have a healthy food? The behavior of the children has a direct correlation with what they eat. Those has been studied. So we are not able to address those simple things, which is the future of the taking care of the kids who are the future of the country. That so it's a process of delivery of care. I think that nothing is going to happen in United States. I'm sorry to tell that. I thought about that for a long time. Why a richest country cannot do this? Why Canada can do this and everything? Because our system of delivery of healthcare is different. For example, I'm a doctor. I want to make a profit. Lab wants to make a profit. Radiologist wants to make a profit. The people who make the machine wants to make a profit. Pharmacy wants to make a profit. Hospital wants to make a profit. Everybody is a small unit and they are just interested in making a profit. And the way the healthcare system works, for example, Mercy Hospital has furloughed or terminated more than 6,000 people. Should they have done it? They are in this crisis, the staff who worked, put their life at risk, is losing their job. Moral and ethics wise, no, they should not have done it. But look at the business model. Mercy Hospital is responsible for paying the bills. They don't get subsidiaries from the tax dollar. They have to pay the bills. During this COVID-19, two things happen. One is more COVID-19 patients, more cost. They need a special group of doctors and the nurses to take care of them. So there is a high demand on those group of doctors and the nurses. And at the same time, where hospital is to make the money, routine gallbladder surgery or mammogram and other, those services are down. So they decided to, and I talked to some of the people and they are devastated because they say, we went there, put our life at risk and we don't have a job now. So the moral and ethics, the system of the healthcare is different. So we need to change fundamentally that all the units should not just keep making profit. That's why the profit is going up and the expense is going up and the outcome is not what European countries are showing. We spend more money and we have the worst outcome. Not worst, but one of the worst outcome. Why? Because we don't have a team. Everybody, free country, I have the right to what I think is right, even though it does not make sense, we do it, and we have the free will. We do whatever we want to do. So this for-profit has to go away, as Canada or Japan or UK. Physician gets salary. Or if you look at in United States, two institutions provides the best care. One is Mayo Clinic and one is Cleveland Clinic. Nobody will question their outcome and quality of care. So why they do so well? Because first of all, their CEO always has been a doctor. So being a doctor gives an advantage to understand the patient's need because they have been there with the patient. And everybody is salaried. There is no pressure to run more tests. I will tell you the private institutions is a routine norm for them to evaluate a doctor that they are employing now, how much revenue they are bringing, which is a reflection of how much tests they're doing. So, the moral and ethics, I'll tell you, I have struggled on this, but at the end of the day, I'm very happy and thankful for the support that I have got from this community, and I'm able to do things that I never thought could have done. Never thought could have done. I'm just giving an example. A cancer patient, I'll take cancer, comes to us and we say, we're going to give this drug A because the studies has shown that it prolongs the life by, let's take a number, 1 year. So I struggle myself, which is, that's the study, but what I am doing, what is the outcome in my hand, or vice versa? What is the outcome of any doctors who are prescribing a drug on the basis of literature? Is it moral and ethics to do that? Can I tell that, well, if you take this drug, you live 1 more year without telling the patients what is happening in my head? Particularly when I'm using the resources from the community insurance and the patients. So I decided that I'm going to collect those data just to know for myself what I'm doing. And I have published in peer-reviewed journal. The publication is another way somebody else to look at the data and agree or disagree. Peer review meaning the people who are knowledgeable on that subject. And when it gets published, that means the authors are saying, this is something that we should let other people read. And many times when you have resources from the pharmaceutical company and other, you have resources to collect the data and publish. I don't have any resources, but I decided to do that. And to take the controversy out, I talked to Professor Lee from Mount Mercy University. She has a lot of PhD students. And I was telling her that I think I have good data. So that ended up her PhD students looking at our data, the electronic record that they can access. And we have published 3. And the last one is how many patients who have incurable cancer, meaning stage 4, are alive at 1, 2, 3, 4, 5 years as compared to national data. we are able to compare at 1 year not only national data, but John Hopkins data. Our survival in each year is higher than John Hopkins 1 year data. And even at 5 years, the national survival is 7.8%. We are close to 40%. So the question is, why did I do that and why it happened? So why it happened is that, I followed patient's bill of rights, explain ins and out, good or bad. I don't sell, I'm not a salesperson. I'm an advocate for the healthcare. So when I do that, and there are a lot of literature on that. When I do that, the patient becomes part of the team. So I create a team, making the patients the quarterback. I'm very fortunate to have a very good caring staff. So for example, if somebody calls with the symptoms, we encourage them. It's a call. And if they call, we see on the same day or next day. We don't tell them, go to the emergency room to all the patients, which is a norm, by the way. You call and say, go to the emergency room. So there are, we talk about the diet, we talk about the 4 health, physical health, emotional health, social health, and spiritual health. It gives an opportunity for me to bring all those things together. By the way, I don't get paid for that. The payment system is more, well, I ordered a CT scan and I reviewed the CT scan. But these are very important aspects of the care. But anyway, so to me, that was the moral and ethical things. Can I criticize somebody else if they do not do that? No. This is my subject. I can keep going, or we can discuss.
Dr. Ghosh, I was about to say that I could listen to you all day, but we're running out of time.
Sure.
Our church virtual will start in 8 minutes. So we probably ought to kind of cut it off. I don't know if there's any last words you want to say, but we probably need to.
No, I think all of you do good, and I want to thank your members who has sustained the APG foundations. They have been able to help so many hundreds of people who lives in this community. So members of your church decided not to just complain, but act. The only thing we are responsible is for our act. We cannot just say that nobody is doing it. We just need to ask, what can I do? Thank you.
Well, thank you very much.
Thank you, Dr. Ghosh.
Your presentation.
Thank you.
Thank you.
I'll say that next week we're going to be joined by Sam Brown of Co-College. And so come back for next week. And I'll be posting this on YouTube later today. Thank you very much.
Thank you.
Bye-bye.
Bye.